So I want to share a screen with you to give you an idea of what we're doing, hopefully a better idea. Because the purpose of the office is to create an ecosystem that really focuses on a I'm about to say faith-based. Thinking about that. Focuses on a public health approach to community safety and public safety. The office really is here to work in parallel with other systems, including law enforcement and police, but we're focused on community responses to public safety. And so this ecosystem, this is a map that helps you sort of wrap your heads hopefully around what this ecosystem would entail that we are building. And we have many parts of this already, whether they're being directed by the Office of Violence Prevention or other organizations or agencies. The purpose of the Office of Violence Prevention is to bring this all under one roof in terms of strategically planning for and directing public safety efforts in the city. And so you'll see reentry on here, you'll see wraparound service, victim services, hospital-based violence intervention, which we have, mediation and violence intervention, which we have. Obviously, we do have wraparound services, life coaching, which is something that's done in around CVI work now, crisis management, which is, a lot of the work we do around our crisis response system, neighborhood stabilization, preventive youth development, and school-based violence intervention programming. So this is what the ecosystem is that we are building out, and it's going to be and it is all interconnected. And that is really the purpose of OVP. So this meeting going forward is where we'll touch on what is happening in a lot of these different interconnecting spaces. There are programs that are that we're funding or that are taking place. But the purpose of OVP is to, once again, make sure all these things are interconnected and make sure we develop a strategic focus. So I wanted to share that with you in the beginning of the meeting, really to let people know where we're going, because I know that's not always clear, especially if we're engaging with you guys one-on-one. And yes, we can make the recording available to those of you. So I'm going to go through a lot of what is going on, share a lot. One of my staff members is going to share some data. If you joined late, please put your name and your title and organization in the chat for me, please. So one of the place I'll start is sort of what's coming up. So we do, if you don't know, we do kickbacks, what are called kickbacks monthly, on the third Saturday of every month. And the purpose of those events is to bring community together with service providers, with people who are vendors who are providing arts and crafts. We have usually some type of video game thing going on. We have music and we have food. And we want to make sure for that day, people are able to take back a space in their community where they may not normally feel comfortable going. We want to make sure they feel safe. We want to create a festive atmosphere, the kickback. And it's really a goal to go to where we know that there is acts of violence taking place and create a different culture, right? In our organization, in our department, we are focused on place-based approaches. We want to go to where people are. We don't want people to have to go to where people provide something. And so our next kickback will be on November 18th at O'Fallon Park Rec Center. I'm going to ask someone in my team to share a copy of the flyer in the chat. We will be, through the generosity of a community partner, giving away turkeys that day, and through the generosity of our academic partner, also providing other food. We ask people to come table. The people who are part of the collaborative we fund always come and table, but anybody else is welcome to table. Anybody else is welcome to let their community members know that this will be taking place. Usually our kickbacks are outside, but we will be moving inside for the winter, but we will not be stopping those events. So this is opportunity for any of you to get to people who don't normally know about your organizations, know about the work you're doing, know about the services you're offering. And we do a really good job, I think, of really engaging people who don't ordinarily get engaged. And so I want to make sure people know about that. Once again, we will make sure we share that information if you don't have it, but that flyer should be shared in the chat at some point by one of my team members. I think is already in there. In December, we're in contact with someone now to hopefully identify a place, but the date in December will be December 16th. We're looking to, once we solidify a location, start reaching out to individuals to provide donations of toys and different gifts. But once again, we will have a space in December. So let me talk about personnel in the office. Like I said, we have 12 employees currently. Most of the work we do is contracting out. So our staff is really focused, and the positions are really focused on managing organizations and engaging with organizations that are providing services. We do currently have 2 positions that we are seeking people for. One is what's called a program manager position, and the other one's a program specialist position. All of these positions are posted. Well, actually, we're actually working with personnel to have these reposted. They were posted originally, but we had to make some changes. So if you have any people you think are good candidates for these positions, we can share the position descriptions. Please send them to us directly. The program manager position we're looking for is someone that either has a clinical background or is master's of social work type person, because they will be engaging with those organizations that are providing more clinical type services. The program specialist, we're looking for someone who is what we would call a credible messenger, someone who has lived experience, who's been engaged in the street, maybe has been arrested, maybe has spent time in jail, because they will be working with the people that do violence interruption work, people who do street outreach, people are trying to de-escalate situations and prevent retaliatory violence. So that's what we're looking for in that position. I will tell you, we will be, and we are working with our Department of Personnel to develop a community engagement / communications position. We need someone who can help plan and execute our community events. We do want somebody to help us get the word out more about OVP in terms of social media. And I do get a lot of requests for interviews. So we will be hopefully posting that position within the next 30 days. And we will get that out to you. So if you have any candidates or potential candidates, please send them our way. We have a website that we hope, and we're building out, really shares a lot of information about OVP itself. One of the questions we've gotten a lot about the work we do in generally is, hey, how do people find resources? Where can people find resources? So we've developed a card, and is Jamie on? Jamie Vergano, is she on the line?
I can attach it.
Okay, if someone can attach it. So we've developed a card. One side of the card gives information about OVP, and there's a QR code that directs people to our website. The other side of the card is sort of a high-level list of the resources that we provide. And there's a QR code that will bring you to a page that we've created on our website, and I'll share my screen now, that we've created on our website that lists resources. And our plan is to give this card out to, officers, to give it out to organizations, to give it out to whoever would like to give it and share it within the community. We would like you all to let us know who might be missing. But the page it will bring you to is this page. And you see we've listed resources by different areas. And if you click on an area you're interested in resources, it will list programs. It will give a description of those programs. It'll give an email address. Where we have a phone number, it will provide that. It will provide a link to that website. And the purpose here is really to hopefully keep people from having to scroll through a website, to scroll through a bunch of information that doesn't get them directly to where they want. And so we're hoping if you would like the card, please let us know. But this is one of the things we're doing generally on our website, and in a way that we hope we can make an impact in the community. And like I said, we'll make sure we get those cards out, or what those cards look like, to everyone. And as you, actually, I think it was just posted in the chat. And if you have any feedback on the information that's listed, or if you think someone's missing, please let us know. Also posted on our website are funding opportunities. So we currently have 2 funding opportunities open. One is request for proposals for what is called community violence intervention. Another one that was just posted is for youth program. So, I'll share my screen again. You can always go to our website, and you can direct anyone to our website. You will see the funding opportunities, and as you click on each one, you'll be able to get to a link for the specific request for proposal. We had an informational session earlier this week around the youth programming proposal. We will make sure that recording of that gets out to everyone. We are partnering with EJUSA generally and around this proposal, and they will be providing support to organizations who are interested, or they can provide support to organizations who are interested in applying for these or submitting a proposal for these funding opportunities. They also are partnering with us to help build capacity in smaller organizations. I think I saw, where is she? Colleen Cunningham, are you on?
Hey, I am here with strange technical difficulties, but yeah, I'm here. Hello. I'll come back on screen if I can get my computer to stop freezing.
No problem. And so Colleen and her organization, like I said, are working with smaller organizations. Their information is listed in the youth programming RFP. But make sure you take a look at that. We can't talk to you about that RFP, but there is a way for you to submit questions. Another thing I'll speak about in terms of the RFP is that we do engage what are called community reviewers at times to look at proposals. If we have one, we probably won't. But if we have multiple proposals, these are people from the community with different backgrounds who want to serve, and they do get compensated for that. I know we have a flyer out and we have an application out for that. I don't know if it's up to date, so we may not be able to put it in the chat now, but once again, we can send that out. We do ask different questions about people so that we will make sure we have a good mixture of people reviewing these proposals, and they're somewhat related to maybe either the geographical area where the services are going to be offered, or if it's a reentry proposal, we want someone with that lived experience, or if it's a youth proposal, we want young people. We want people who these services are meant to support, to look at these proposals and provide feedback. They aren't the final say on whether the proposals are accepted or not, but they are an important part of making that determination. So that is what I'll stop there with that. We often work with partners, and there's often events that we promote that we think are important as people learn about community violence intervention work and the work of the Office of Violence Prevention. So on Saturday, November 11th at 4 p.m. at Washington University, there is a screening of a film called The Body Politics, which highlights the work being done in Baltimore, and that has been done in Baltimore, similar to the work we're doing here in the ecosystem we're building. I'm going to attend. They've made this free, attendance free for anyone who wants to attend. I think it's really important that as many of you as possible, as many young people, I've invited elected officials, really attend this screening if you can, because it'll give you some background and an idea about the work that is being done around, not only in St. Louis, but around the country, around public safety and engaging community in public safety. So I'm putting a link in the chat That way you can reserve a space for this event. And I would highly encourage all of you to join. The Office of Violence Prevention funds work in many different areas. It's all really under the umbrella. The strategy is community violence intervention, but there are many different initiatives that we fund, like I said, from reentry to youth diversion to crisis response to trauma-related services and all of and so on. So one of the things we do, and we've been doing for 2 years now, is we partner with behavioral health response around engaging people in crisis, stabilizing them, connecting them to services, and doing ongoing care management. We've been doing that through 2 programs up to this point. One was a call diversion program, which is an alternate response where people are transferred directly to a crisis line. And another is a co-responder program where clinicians are riding with officers. Well, we're expanding on those programs. We're creating another alternate response, which is going to be a non-law enforcement response. And we are embedding clinicians in our 911 call center. You know, everyone knows the challenges in the call center. The director of public safety has done a great job in staffing up. They've raised the salaries. So I know that 911 services will improve. And I think embedding of the clinicians in the call center will greatly improve that. And those clinicians will be there to improve and increase that call diversion, but also to be able to dispatch these non-law enforcement responses. So over the last couple of months, clinicians have been doing training. They've been working with our partners at the SLMPD. They are currently completing training. We're completing some workflow developments, and we're anticipating in the first week of December, these clinicians being able to do a soft go live within the call center. I'm going to ask Eli Horner from Behavioral Health Response to give a little bit more update on that.
Well, you stole most of the words from me, Will. Yeah, to Will's point, we have 3 crisis call dispatch specialists, couple internal that transferred who did some care coordination and have done crisis response. So we're excited to have their perspectives on that end. They've already been through a 4-week training with dispatch over there. They came back and worked with our contact center team to shadow calls on that front. They just started going back this week to begin shadowing dispatchers so that they can start observing what that's like. And then they're also going to get trained on the CAD system on how to enter and exchange notes up there. So we got our own little space over there, just about getting our equipment and everything in there. And then, like Will said, here in the next few weeks, we're going to start trying to soft launch some things, taking calls. The cool thing is that those crisis dispatchers are going to be able to dispatch our non-police responders, which is really cool. So while we already have the crisis response unit out there with the SLMPD pairing and getting dispatched on that front, we'll have our own capability of being able to handle low-level calls, low-level CIT things, and self-sufficient needs from our own front and free up SLMPD and other areas to be able to continue to do higher-level things. So we're excited. Oh, you're on mute, sir.
Thanks, Eli. I appreciate that. So just once again, I'm just trying to go through the day and really give you a high level of all the things that are happening with OVP. If you have any questions, if we have some time at the end, you can ask, but you can always reach out as well. So on the reentry front, we do contract with 2 organizations currently. We're currently reviewing some other RFPs and potentially we'll be contracting with some more around reentry. But one I think of the great things that is being developed in the process of implementation now is work that's being done by the Integrated Health Network. I know some of you may have heard this on call before, but we have new people on here. And they are, through that work, they are working with SLU's School of Medicine and Dr. Catherine Matthews to launch a transition clinic. I think I saw Latrice Tate on here, if she wants to just give a quick update and overview of that.
I'm here. Good morning, everybody.
And introduce yourself.
I can, I'm sorry. So my name is Latrice Tate. I am the Assistant Director for Justice Initiatives at the St. Louis Integrated Health Network. Some of you may be familiar with the program ReLink. That is one of the programs under the Justice Initiative services provided by the St. Louis IHN. So to Mr. Pinckney's point, we are in collaboration with SLU, School of Medicine, and just their medical providers in developing the region's first transitions care clinic. And so the purpose of that, and it's actually a mobile van. And so the purpose of that clinic is to bridge the gap between when individuals are released from custody, so whether it be jail or Department of Corrections, and getting them kind of those initial medical services that they may need attention to, not to be confused with things that they need to go to the emergency room for or to urgent care for, but just some of those stabilization medical needs, and getting them treated for that, or getting them, and then also getting them connected to a primary care physician or a behavioral health specialist in the area. And so we are diligently working to identify a driver. We do have a really cool mobile care unit or van that is just sitting stagnant, waiting to go. It has exam rooms in there. Dr. Matthews is really excited to really dig into the women's health care aspect, and be able to provide cervical exams and things like that on the van. So yeah, we're just kind of working out some logistics in the interim. We've been kind of checking in with a couple of our partners, including Mission St. Louis and Keyway, just to do some sort of education, triage, referral type services for their clients at their locations, and also just kind of allowing the staff to get familiar with who we are, so that they understand that they have a trusted partner in this space. So we're doing a lot of work on that. We have, we have a lot of big thinkers, and so we have a lot of what we want to do, but we are really kind of focusing on just making sure that we do it right, and then that way it can be a benefit for everyone.
Thanks, Latrice. Appreciate
No
it.
problem. No problem.
So, once again, this is just to give you an overview of all the work that's going on. I know people often say there isn't much going on, and there is a lot, and obviously it's more than what we're even describing here. Something else that we're looking at now is, I had in that graphic of, the ecosystem, it talked about hospital-based violence intervention. There's a great program already in existence in the city of St. Louis called Life Outside of Violence. I see Kateri, I'm asking Kateri Chapman in to speak about this really quickly. But we are at the Office of Violence Prevention working with and in conversations with BJC and the WashU Institute of Public Health about making sure that the work being done by Life Outside of Violence is connected better to the street outreach work that's being done through OVP. I had some recent conversations this week with Deidre Griffith from Barnes-Jewish Hospital about connecting better to the work that BJC does in the community and the work that OVP is doing in the community. So Kateri, I don't know if you want to share a couple of words about this and about love.
Sure, thanks, Will. So the hospital-based violence intervention program is affectionately known as Life Outside of Violence, or LOVE, to the community. And so we launched in August of 2018. And so this is a regional partnership between our 4 level 1 trauma centers. So that's Barnes and SLU on the adult side, and St. Louis Children's and Cardinal Glennon Children's on the pediatric side. There's many HVIPs across the country, but we are the first and still only that is system-wide, right? So we have these 2, by definition, would be competing systems, have come to the same table to share data and resources to support victims of violence. And so essentially we're working with 8 to 30-year-olds that come into one of those 4 level 1 trauma centers with either gunshot wounds, stabbing, or assault. We ideally meet them at bedside, and this is to Will's point of making sure we have the right responders showing up 24/7 to engage with victims at that time and or families. And then we connect them to a clinical case management team that works with them for give or take up to a year, providing direct mental health, case management, really whatever the participant decides they want to work towards, not just for their medical healing, but all of the things in life, and goals. So that's essentially what we've been doing and will continue to do. And thanks to you all, collaborators, and for your support.
Thanks, Kateri. Appreciate it. We talk a lot about what's happening with system actors, but there is also work happening within community around public safety. So there's something called a Public Safety Collaborative, which has started in the city thanks to our partnership with the Center for Police and Equity and the Urban League. And the Public Safety Collaborative is a group of community residents and stakeholders working together to promote the co-production of public safety with the goal towards reducing crime in the city. What they do is they focus on strategy, resources, and tools. They focus strategy, resources, and tools on places, right? So this is a place-based approach. And so they're looking at places where crime is likely to take place instead of looking at the people who are committing crimes. The services are provided by what is called the Data Informed Community Engagement, or DICE. You may start to hear that term a lot. And risk terrain modeling, or RTM. What RTM is basically a risk assessment technique and a diagnostic that identifies spatial attractors of criminal behavior. So what are the things in the community? What are the things in the physical environment that attract criminal behavior? And it looks at environmental factors that are conducive to crime. And what RTM does is basically just explain where and why crime occurs, and it allows these public actors to focus on place-based opportunities to reduce crime. So this Public Safety Collaborative is looking at data that they receive from the police department, and they're working with, I believe, people from Rutgers University to look at police data and look at the environmental factors to, like I said, focus on what is attracting crime, what are the reasons from the built environment in which crime is happening. So this is driven by community, done by community, decisions are made by community. The work is being led by Farrakhan Shagag. I don't think he's on the call today. I know Amanda Matthews from the Center for Police and Equity is on the call. I don't know if you want to add anything, Amanda, to what I just said.
No, that's all right. Thank you, Will.
Okay. So I just want to raise that up because it is some important work that's being done and led by the community as it relates to public safety. On the youth diversion front, we're doing a couple of things because we're focused on young people. Obviously, we have high rates of young people being shot and victims of gun violence in our city. And it is an important issue that's being tackled by many partners. We're working in partnership with the family court. My good friend, Chris Fahey, who's on here, who oversees the DJOs, and Lieutenant Muldrow, who's over the juvenile division, and an organization and the Youth Advocates Program, along with the Violence Prevention Commission and the Mental Health Board. So the Youth Advocate Program is an intensive mentoring program that engages youth in a minimum of 8 hours of mentoring a week for at least 6 months. So we're working with the family court and the police department to identify the youth that will be served under this program. We have a year-long contract, or at least MHB does in the short term with them, to pilot this work. We're hoping to get that going in the next, I'd say by December, so that they will be able to start accepting referrals. They have secured a physical location in the city. They have hired advocates from the city, community residents, people with lived experience, to really engage these young people. So that's one thing we're doing on the Youth Advocates Program. The other thing, on the youth diversion. Another thing we're doing is we're looking at a youth assessment center in partnership with UMSL, our academic partner. We've had one meeting and we have another one next week with organizations that provide different services for youth. And we're looking at launching a space and having organizations co-locate. I think I saw Chris Sullivan, who is our academic partner from the School of Criminology or Criminal Justice at UMSL. Chris has done a lot of work on this, so I'm gonna let him give any high-level thoughts.
Thanks, Will. Yeah, so basically what we're doing is looking at both needs here, and then also how these assessment centers have worked elsewhere, and trying to implement something that's based on best practice, but is also driven by needs of the community and youth and families in the community. And so we are currently, have, as Will mentioned, convened one meeting, kind of got some feedback there, and have started to look at kind of what the process will look like in terms of the assessment, assessment and then referral. And then we'll kind of get to know as we go forward in the next meeting or two, which organizations will be involved and then how. So right now we're kind of trying to take stock of what's here and who wants to be involved, and then also map that on or utilize information that's already out there in order to get it off the ground as strongly as possible, and then be in a position to make modifications if needed.
Thanks, Chris. Appreciate it. We also in conversations with the circuit attorney's office and the new circuit attorney. They have some really great ideas on diversion. Obviously, our goal is to get people out of the system and provide them the supports they need so they don't have any recurring contacts. So we are in conversations with the circuit attorney's office to support diversion work. And this will be non-court ordered diversion. So this will be diversion where, you know, we're looking to not hold a hammer over people's head. We want people to really be able to get out and get the help they need to change their lives around. So I'll have some updates on that later. We have engaged a new technical assistance provider for violence intervention work, which is Live Free USA. As you all should know, we've contracted with an organization called Mission St. Louis, who will be hiring the violence interrupters and running 4 sites around violence interruption work, which is basically street outreach to decrease acts of violence and retaliatory acts of violence. That implementation is ongoing. They've posted positions, they've been hiring or interviewing, excuse me. They hope to be hiring soon. I know Kenny is on here. I'm not sure who else from Mission St. Louis. If you want to add anything, Kenny, about that.
No, things are going well. Yeah, we have been doing interviews. I did want to put out there that probably one of the areas that we maybe don't have any prospects for as far as site supervisors is the Dutchtown area. So if anybody knows that area well, knows some people in that area that could potentially be a site supervisor or violence intervention workers would be good. We also still haven't pulled the trigger on a program manager. We got a couple prospects, but that position is still up for grabs as well. So
Kenny,
go to our website.
Tasha Smith is on the call from Dutchtown.
Okay.
Tasha, I forget. I'm confused. I'm about to say Dutchtown Community Development. It's not that. Dutchtown Streets. Go ahead, Latasha. I'm gonna get it wrong.
That's okay. Dutchtown Main Streets Organization. I was just sending Kenny an email. If you can connect us, Mr. Pinckney, that'd be great.
Yeah, Kenny, put your email in the chat.
Sounds good.
Kenny, put your email in the chat and Latasha will reach out to you. Thank you very much.
Gotcha.
Thanks, Kenny. We also have been convening people from the faith community. Some of them are on this call. Reverend Norris, I think I saw, and Myron Gray, some others. So the goal there is to see how we can work with faith leaders to support the communities in the areas where their houses of worship are. We had one meeting, a great conversation. We're having another meeting, I think, on Monday. So if you are a faith leader and you're not invited, or you know of a faith leader who should be there, please make sure you reach out to us so that we can continue to develop that partnership. The meeting will be Monday at the Deaconess Center. Another thing that we have going on is that we've been asked to oversee some funding for summer youth jobs, and at this point, I think it'll be youth jobs because it's for this fiscal year, which ends in June, so the summer won't have started yet. So we will be putting out an RFP at some point in the very near future for people who are looking to provide employment opportunities to young people. I think we are always looking for creative ideas around employment for young people and stipends. I mean, listen, we're looking to target those that are carrying weapons and, you know, involved in violence and involved in stealing cars. And if you're asking someone like that to change their life around, you have to have something for them. So if there's creative opportunities to provide stipends as they're doing skills and all of those things, we're going to look into all of that. We're going to look to all of that as we put together this RFP and do what we can to make sure the services that are needed get to young people. So I wanted to throw that out there. We oversee Prop S, which is funding about $1 million a year that's allocated to at-risk youth programming. The funding and the determinations are made by the Board of Aldermen. So we oversee the contracts, but they make the determinations about who gets funded. We are in conversations with the Board of Aldermen around Prop S. I think the program is going to change, and the timeline in which the funding was provided is going to change somewhat than it has been in the past. But you know, we will be putting information on our website about all these different initiatives, the organizations we fund. So just keep an eye out for what's happening with Prop S. I do want to bring Chris back so that he can talk really quickly about the evaluation. Chris and UMSL got a grant from the National Institute of Justice that's going to allow them to help support us and do some evaluations. So Chris, if you want to talk about that quickly.
Yeah, sure. Thanks, Will. Yeah, so the other thing we're doing at UMSL, colleague Lee Slocum and I submitted a grant and also Kylie Bednar, who's in the Center for Innovation, Community Innovation and Action Center. So we submitted a grant to the National Institute of Justice in May or early June, which is meant to provide some evaluation and then also support and capacity building for the partners involved with the community violence intervention group under the Office of Violence Prevention. So what we're going to do is basically, you know, talk to as many groups as we can, get a sense of the, you know, the broader kind of context in the city for doing this work, trying to understand both kind of the youth and early adult level outcomes in terms of services that people are receiving, in terms of injury and violence, but then also try to understand things from the program or organizational level, as well as the city and OVP level. So we're going to conduct some interviews. We're going to conduct interviews across the range of who I just mentioned. We're going to look at some of the record data, and then we're also going to look at some document reviews to try to put this all together and do a comprehensive evaluation. The other thing that we're doing, which is somewhat unique, is setting this up in a kind of a rapid evolving evaluation framework so that we can kind of get information out relatively quickly. Obviously, we will kind of update and modify as we go, but the idea is to make sure that this the project period is 4 years, but we want things to be ongoing in terms of the reporting back to OVP and then also the different constituencies who are interested and involved and have a stake in the work that's happening. So that's in a nutshell. Basically, right now we're doing kind of administrative tasks to free up the funds and meet the obligations we need to meet to get the feds to release the funds. And then also we're going to start recruiting soon. The one thing I'll mention is if there are people you know of either that have contact with your organization, young people especially, maybe college age, we're going to be trying to hire some interviewers and people to help us do the work who are, as Will mentioned, more closer to the community.
Thanks, Chris.
Yep.
I appreciate it. Maybe you can put your email in the chat or whatever email you want to share if people want to reach out to you with individuals that they think would be really good for what you're describing. So I I'm going to let Jamie do the data, but I just wanted to give you somewhat of a breadth of the work that OVP is leading, involved in, and show you that we're not just focused in one area. It is about a comprehensive ecosystem that we're building out. We've been bold and ambitious. We've only been around a year and 3 months, but I think we've accomplished a lot. This is about getting to the right people. This is about getting to those who are most impacted. I ain't even getting into people who are directly impacted by violence in our city, which we do engage with them as well. But we are trying to target those most at high risk. And so we really want to engage the people that, quite frankly, people walk down the street and if they come upon them, they're going to cross the street, right? We need people that engage them, just like we do need people for preventive work as well. And that's probably more geared towards that youth programming RFP. We do want to be very transparent. We want to engage people. We want to engage people through these conversations to let people know what we're doing. We want to be transparent on our website. We will be putting data up there, but we want to be transparent on what's going on. And we want to make sure that we can engage as many people as possible who are in these communities that are most impacted. So that is going to be the purpose of these calls going forward. We will start these calls in the beginning talking about some data. Well, obviously, we'll let people provide feedback and ask questions. But I think this first sort of restart of this conversation was really like, let me let you know what OVP is doing so that you can hopefully go out and spread the word about what OVP is doing and get people to give us feedback and ask questions. So I'm going to hand it over to Jamie. I know we don't have a lot of time left, but Jamie's going to give you an idea of the data that we've started collecting data from the people we fund. This isn't all of it, but give you an idea of the data that we are looking at. Go ahead, Jamie.
All right, can you see my screen?
Yes.
Okay. So as Will said, we've been collecting data from partners. This isn't all of our partners because there's a few that just have their data, like health data, that's more protected. So this is just the majority of them right now. So you can see the unique count year to date without the 2 partners that aren't in here is 356, or contract to date, I'm sorry. So July and through, actually we have data through September. So October's data isn't due quite yet. So July through September, we've had 356 unique clients served. And then you can see the breakdown of the clients served by each of the partners. You can ignore the Simply Strategy one. That's not supposed to be in there. Let's see the clients by neighborhood. We have a breakdown. Some are in non-priority neighborhoods. And then we have 33% of the clients are from priority neighborhoods. We're hoping to increase that. And we are working on improving our reporting processes so that there's a lower percentage that the neighborhood isn't reported in. Although for some situations, it's a little tricky because if someone's incarcerated, which neighborhood to consider can be kind of questionable. And then there's a small percentage that's unhoused. CVI clients, this is just a further breakdown of this pie chart. So we break down these priority neighborhoods further. So the vast majority of those that are served in the priority neighborhoods are in Baden. Maybe I need to zoom in. These percentages are tiny. That did not help at all. Okay. Our Baden at 36% and Dutchtown at 21%. And then we have a breakdown of each partner and their neighborhood presence. We have breakdowns by age. So the majority of our clients or partners' clients are between 20 and 39. These are the 2 biggest age groups. We have a race breakdown with the majority being Black or African American. And then the employment status, about 50% of the clients being helped are not employed. And then here we have a breakdown of the resources provided. So things like transportation fares, anything, any monetary assistance, lodging and hotel indicates if their lodging or hotel was paid for. That's usually for emergency services to remove someone from a dangerous situation. And then things like helping people get access to their IDs or birth certificates or things that they need to be able to get a job and things like that. So that's the partner data. And then I mixed up the timing of this meeting. So this dashboard is not where I want it to be, but we're going to look at it anyway. We're starting to build out dashboards from police data. So this data is specifically firearm assaults, and I believe lethal firearm assaults are not included in this data. So this is non-lethal. So if we look at over time from January through September, you can see this is an incident count by the neighborhood status, whether it's priority or not that the incident took place in. So we can see this drop from July to August. There was about a 31% drop in incidents in the priority neighborhoods, and it stayed at that lower level through September as well. So we're hoping to keep that and maybe decrease it even more. Here we have this is kind of a similar graph here, but this one wouldn't let me add labels to it for the overall count. So for priority neighborhoods, these are the incident counts. And I will eventually have more detailed information on the victims. I just did not quite get to that. And if we break down the firearm assaults by injury status, this is a count of the incidents, not the victims. I do have the count of victims in the next chart, but we can see that Dutchtown, these purple areas are the injuries. Dutchtown and Baden have the highest, and Penrose have the highest absolute counts of incidents that result in injury. And then we can see over here just a simple look at what percentage of the incidents are happening in priority neighborhoods, and it's about 32%. We have incidents by victim age. This is a little funky. I don't have a lot of control over this, but eventually this will be in Tableau and it'll be a little bit more viewer friendly. So when we break down the victim ages, the majority of the victims are ages 31 to 40. That's about 22%. And then the next highest age range is 19 to 25. That's 19%. And then they decrease from there. So this is the order in which largest to smallest these ages of victims are prevalent. And the last one here is firearm assaults by injury status. So it's similar to the one above it, but instead of counting the incidents, it's counting how many injuries actually came from the incidents. Similar though, Dutchtown and Baden and Penrose are the neighborhoods with the highest victims that resulted in injury. So that's a little bit of an overview. We're going to be drilling down a lot more than that. So this is just kind of a rough draft. And then I can take any questions. And then Will, did you want me to talk about the little card, or did you already do that? The resource card?
No, I did that. I'm going to try and
Okay.
answer a couple of these questions before we finish up that were in the chat. But let me do that first before you answer questions. I mean, I will just say Jamie's doing a great job, obviously digging through a lot of data. We're going to use the client data and the incident data we're receiving from the police department to understand, are we in the right places? Are we connecting with the right people who we're seeing, at least in reported incidents? Obviously, there's unreported crime as well. So, that data will evolve, but that is the purpose of us looking at the data to see what we're doing and to share information with you all about where and how the people we're actually funding, who they're engaging with. Because you may see and identify a gap, and then maybe that helps us think about what other funding opportunities we need to follow through on, what grants we need to pursue, what types of organizations we need to fund. So everything's going to be done with a lens towards data. I just want to answer a couple of questions. I don't know if people are still on. I know Latasha asked, how do we get involved with this? We definitely going to need volunteers. Obviously, the organizations that we fund may need volunteers. So I think being on this call and listening, engaging with us outside this call, and as you hear, offering where you feel like you can plug in, I think will be important. Kanjit asked about any programs targeting towards school fights, challenges, and SLPS. So through our youth diversion work through the YAP program, I say we can address some of that. I don't know if they're on here. I think I saw Sheila earlier, but Conflict Resolution Center has a really good peer mediation program that we support. I see Sheila on here that is really geared towards that. They've done some really good work in a couple of schools in the city, and they've actually, I believe, started using that peer mediation in some active disciplinary issues in schools. Sheila, you want to mention something real quick about that?
I just know that we have mediation rooms set up and the kids are using it. They're very excited. They got their peer mediator shirts approved as uniforms. So visually it's going out. We're at 3 charter schools right now. We are having a little bit, we're trying to get into the St. Louis public schools, but we're having a hard time there. So we're actually doing our program at some of the library locations. So my email is in the chat, but it's sheila@crcstl.org if you have any questions.
Yeah, so if you're looking, that's another way to get involved as you hear about programs like that. I'm sure Conflict Resolution Center has no problem if people want to volunteer, people want to support that work. We support it. I'm on the steering committee. That is the type of work that someone can apply for under either one of our RFPs. So if somebody is interested in working around that issue, obviously the schools are separate from us. So, you know, you'd have to get some permission to work with a principal or whatever to get in the school, but there are ways to get to kids outside of the school itself. So hopefully that answers your question, Kanji, if you're still on. I think those were the only 2 questions I saw. Oh, is crime increasing or decreasing? Great question. So I can tell you, and actually I could pull it up right now. Since the beginning of the year, let me make sure I'm quoting it directly. Since the beginning of the year up until October 29th, crime is down 21% in the city year to date. Murders are down about 17%. You know, so we see a large decrease in shooting incidents. Generally, they're down about 12%. These are tentative figures, by the way. Shooting incidents involving juveniles and juvenile victims are down close to 40%, each of those categories. So we do see crime trending in the right direction. I think the challenge around looking at decreases in crime, it takes the spotlight off the numbers. So while we could be down 30%, 20%, obviously crime is still too high, especially if you talk to people that live in the communities where crime happens, right? So we have work to do. We can only do that work together. And that's the purpose of this call. So, you know, I hope this has been helpful. I know we're at time. I'm going to leave the chat open for a while if anybody wants to scroll through and get any of the documents or contact information. But we do have this call once a month. You don't have to wait till this call happens to reach out to us and ask questions. Our website is there. We have an email address that's violence-prevention@stlewis-mo.gov. Our phone number's on our website. So please reach out if you have any questions, if you need anything, if you want to partner. We can't ask the question about the RFP, but we do encourage people, especially small organizations, to apply. So that's all I have. I'm sorry we didn't have time for more questions. We will let that next time, but thank you very much. You all have a great day. And like I said, I'll stay on a little bit so people can look through the chat if they want to take anything out of it.
Yeah, real quick, I can see that people are asking if they can have access to this data, or at least the dashboard. I'm not sure about the police data. Will, can you speak on that?
Yeah, so I mean, any data, like we won't give you the direct police data, but anything that we create, we can give you. We won't give you access to the dashboard, but we can create reports. And we do plan on publicly publishing data. I think we want to get the data in the right format and put the right data up. I mean, we don't want to put just all this data up. That's a lot. I think it's too much for people. We want to find out what's helpful for people. So we will have that conversation, but we can put something together. And I think Jamie said she's still working on the firearms data anyway. We did start a data group. I know people are dropping off, but we did start a group to talk about data and what might make sense in terms of presenting data to community. We are thinking when working with our partner at CPE about starting that back up again. So like I said, I will want to make sure we're presenting the right data to people instead of just inundating people with numbers. I don't think that's helpful. So we could talk about that again next month as well. But thank you all very much. Anybody who's got to drop off, please do that. Like I said, I'm gonna leave the chat open for a little bit, and I'm gonna stop the recording, but we can try and share that recording. It's going to probably be a large file, but we can share the recording when it's done, when we get it done. Thank you.